Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Microcephaly. In microcephaly, head circumference is more than 3 standard deviations below mean for age and gender. Causes of microcephaly. There is isolated microcephaly and there are syndromes like trisomy 13, trisomy 18, trisomy 21 which are important in microcephaly. Fetal alcohol syndrome and fetal hydantoin syndrome can cause microcephaly, and neural tube defects can also result in microcephaly. Structural brain defects along with neuron migration defects can also result in microcephaly. Neuron migration defects resulting in microcephaly are schizencephaly, which shows clefts in the midbrain, porencephaly, where there are cavities in the brain. So degeneration of these results in are due to infarction, and there is lissencephaly, where there is flat and smooth brain is seen in lissencephaly. And there is also corpus callosum agenesis. In corpus callosum agenesis, the two lateral ventricles and the third ventricle uh, is seen, and this is seen as a moose head sign or racing car sign. So because the corpus callosum is not produced in the corpus callosum agenesis. Other diseases, like there are torch infections like rubella and cytomegalovirus, exposure to teratogens is seen, and endocrine disorders like hypopituitarism, hypothyroidism, and growth hormone defects are also seen.
thank you and thank you for watching.